women in particular are more likely to have silent arrhythmias. This means that they actually seek medical help later and they present later, and it also means that the disease may have been in there for a longer period of time, and we found that this actually leads to poorer outcomes. I'm Dr. Kelvin Chua. I'm a cardiologist and an electrophysiologist, which basically means a specialist who deals with heart rhythm disorders. Basically, when we were born in mommy's tummy, the heart has its own pacemaker that is located at the top right-hand corner of the heart. It fires electrical impulses like a clock to regulate the timing, the rhythm, and the pumping action of the heart. Any deviation from this rhythm or timing would be considered an abnormal heart rhythm or a heart rhythm disorder, or in medical terms, what we call an arrhythmia. An abnormal rhythm can affect the heart's function in many ways. One of the most common arrhythmia is called atrial fibrillation, or AF in short. What happens is it has many electrical impulses occurring in the top chambers of the heart at one time, and that causes irregular pumping of the heart, that causes symptoms of palpitations. On top of that, because of the irregular nature of it, blood circulation is poor, blood clots can form, and when these blood clots travel to the brain, they can cause a stroke. So there can be many devastating consequences of abnormal rhythms. Heart rhythm disorder is classically diagnosed using an electrocardiogram, which is an ECG. Many of you may understand that when we go for health screening, we do an ECG. An ECG is actually a record of the electrical activity of the heart, and through that we can diagnose any heart rhythm disorders. That's the main way. There are many other ways, such as a Holter. A Holter is a monitoring device that is like an ECG, but is carried with a person over 1 day to 7 days, and that allows us to catch abnormal rhythms that happen sporadically. There could be other devices as well. Many of you may know about the watch, which have ECG capabilities, and those have proven to be useful as well. So the main lines of treatment are split into three main therapies. One of them is a lifestyle modification. So usually we ask patients to try and lead a very healthy lifestyle, avoiding too much caffeine, alcohol, try and reduce their weight and exercise regularly. That is a conservative measure. The next in line, we would try medication to try and curb or reduce the heart rhythm from running too fast, too often. The last is actually a procedure called catheter ablation. This is an invasive procedure where we insert tubes through blood vessels in the leg into the heart to find the abnormal rhythm and eradicate the abnormal rhythm. All depends on how the patient feels. For example, if the patient is having only one episode a year and the patient did not feel too bad with it, usually we will ask the patient to maybe have standby medications and do the conservative measures like what we talk about. If a patient, on the other hand, has very frequent symptoms, maybe daily symptoms, maybe weekly symptoms, and each episode can be debilitating. For example, they may have the heartbeat running so fast that they may almost lose consciousness. Those are pretty serious, and we will ask them to consider a procedure. Another type of abnormal heart rhythm is something we call supraventricular tachycardia, or SVT in short. Basically, the heart has only one central expressway in the middle of the heart that conducts electricity from the top chambers to the bottom chambers. When people have supraventricular tachycardia, they have an additional nerve that they are born with, and this allows the electricity in the heart to sometimes short circuit and cause it to run in a very fast manner. So you can imagine it like a F1 circuit when it's going around in races, causing very fast heart rhythm as well. Silent arrhythmias mean that the person is experiencing an abnormal rhythm but does not display or feel any symptoms associated with it. This is crucial because I was part of a white paper that was released last year in collaboration with a few heart rhythm specialists in Asia Pacific region, and we found that women in particular are more likely to have silent arrhythmias. This means that they actually seek medical help later and they present later, and it also means that the disease may have been in there for a longer period of time, and we found that this actually leads to poorer outcomes. Hence, actually I would propose that most people try to do regular health screening in order to detect some of these silent arrhythmias.